Hey y'all, it's Molly from Better Bellies by Molly, and today I'm going to give you a few tips and tricks on using medicine that goes up your bum, specifically enemas. So when I was first diagnosed with ulcerative colitis, I was prescribed an oral medication, but a few months later, I was also given a rectal medication called a suspension enema, meaning medication for my colon. Almost like putting lotion on your skin, but the skin is kind of like in my colon. So you have to use an enema. Here's an example of an enema. Woo! So over the years, since it's been 8 years since I've started using this medication, I've learned quite a few tips and tricks and ways to make the uncomfortable administration a little less uncomfortable. Now, granted, it's still not fun and I still put it off and dread doing it all the time, but I hope that these tips and tricks can also help you in your journey. And make sure to follow me on Instagram at Better Bellies by Molly. So first tip that I have is that when you get your enemas, they will probably come in some sort of foil container like this. This is 1 week, 7 days of enemas. And even when I open them up to take an enema out, I still keep them sealed like this. When I first got diagnosed, I didn't know this and I didn't realize how much of a difference that it made. So I organized them neatly in a drawer and I just kind of laid them out like this. Had no idea that keeping them in the foil is what really helps keep the plastic that they come in malleable and squishy. And you want them to maintain the malleability so that they're less hard to administer. Another tip that I have, in addition to doing the foil, is getting all of the air that's inside the enema out before you administer it to yourself. So after you're either before you get cozy or once you've already gotten cozy and into the position that you need, what I do, and this is just how I do it, you're more than welcome to do it your own way and just take it out of the container and administer it and be on your way. But something that I find really helpful and I feel like it really makes a huge difference for me since I have to use these so frequently is getting all of the air bubbles out and sometimes even getting a little bit of the medication out before administering. So let me kind of show you what that looks like. So you grab an enema out of your foil container. Then I take a tissue like this, a clean one, and I pop off the top and into the tissue because I don't want it to squirt everywhere. I squeeze the bottle with my fist and I let a little bit of the medication come out and all the air bubbles come out and you can hear them sometimes. And then the bottle will end up getting squished like this, and this is what you want. You want there to be as little air in there as possible so that you're only putting medicine in your colon and not medicine mixed with air. The air gives really bad gas and cramps and pain. So to avoid all of that, this is one of the tips and tricks that I've learned. So once all the air is out, then this is a bottle that is ready to be administered, in my opinion. This bottle that's completely full and you haven't gotten the air out of, this is not ready. Ready, not ready. Ready, not ready. Okay? So then once you have all of this, then you can administer it and everything from there on out. Or you can always pop the top back on and save it for later if that's what you needed to do. A few other tips that I have are getting comfortable, taking deep breaths, finding a distraction, reading a book, watching TV, something like that, because you're putting medicine into your colon, which is a pretty uncomfortable thing just in general. And the more you can relax, the more you can breathe, the better you'll feel in terms of not trying to push it out, not running to the potty, and things of that nature. If you do, gotta go, that's okay. One thing also to note, don't be surprised if what goes up comes down, meaning if the white medication comes out in the toilet, that's normal. You should probably and most likely will see some of this coming out the next time you go potty. But if you've got IBD, you've probably seen way worse things. Am I right? So I hope these tips help you a lot. I hope they give you kind of like a mind's eye visual that goes along with my blog post. I have an entire blog post on my blog, betterbelliesbymolly.com, all about using retention enemas with even more tips and tricks than I was able to include today. Hope this was helpful. And if you think so, please subscribe.